In this presentation, we're going to go over the cranial nerves 5, 7, and 9. And it's very important that we go over the objectives. So for this presentation, we're going to list the type of nerve fibers found in these cranial nerves. We're going to describe their location. We're going to describe the peripheral distribution and functions, and we're going to describe the clinical manifestations of the disorders affecting these cranial nerves. So we're going to get started with the trigeminal nerve. And the trigeminal nerve, remember in general the functional components, it's that it's going to be special visceral efferent, innervating, for example, skeletal muscle fibers from the pharyngeal arches, or it's also going to be general somatic afferent, which carry sensory information from receptors in different areas. So the trigeminal nerve, basically the function, it's mixed. So we're going to have sensory and motor function. And it has three divisions. We have an ophthalmic division or branch, which is for the sensations from the forehead, eyelids, and nose. We also have the maxillary division or branch, which is for sensations from the lower eyelid, upper lip, and the cheek, the face cheeks. And we also have the mandibular division or branch, which controls mastication. In here, the origin of this trigeminal nerve, specifically these branches for the ophthalmic branch, this is basically the ophthalmic division on the orbital structures, the nasal cavity, the forehead, and the superior eyelid. For the maxillary branch, the origin is the inferior eyelid, upper lip, gums, and teeth, also the palate and part of the pharynx. And for the mandibular branch, the origin is the lower gums, the teeth, the lips, the palate, and also the parts of the motor nuclei of the pons. Now we're going to go over the foramens and destination. For the ophthalmic division, it's going to be the superior orbital fissure, as you can see right here in blue. The maxillary division goes through the foramen rotundum, which you can see here in blue. And for the mandibular division, it goes through the foramen ovale, which is the one you see there in blue. And the destination of the ophthalmic division and maxillary division, it's to the pons. But meanwhile, the mandibular division, it's to the muscles of mastication, which are this one, temporalis, for example. Also, it's very important to mention that the trigeminal nerves are the largest of the cranial nerves. And also, there's going to be this ganglion called the semilunar ganglion. And I'm going to make a quick stop, because if you are enjoying this video, please like, share, subscribe, and leave a comment if you have a question or a suggestion. All right, let's continue. Now, the facial nerve, this one, the functional component, it's going to be general visceral efferent, where we're going to have preganglionic parasympathetic fibers, and it's also going to be special visceral efferent to innervate certain skeletal muscle fibers. And we're also going to have general somatic afferent fibers that carry sensory information from certain receptors. And we're going to have fibers that are special visceral afferent that carry olfactory or gustatory information, for example. So in the facial nerve is this one right here. And the facial nerve, the function, it's mixed. So there's going to be sensory and motor functions of this nerve. The sensory portion is for sensations of the face and taste. Even though the main nerve for sensation of the face, it's the trigeminal nerve, facial has some areas that we can use to feel sensations. But most importantly, the facial nerve has fibers that are controlling the muscles of the face. right? So for muscles, the muscles of expression or facial expression. The origin of this nerve, it's for the sensory part, it's the taste buds, and for the motor part, it's the pons, right? And so the foramen is going to be the internal acoustic meatus, and I'm going to show it to you in another view, but the destination is going to be the sensory, for the sensory part is going to be the pons, and the motor part is going to be the muscles of the face, like I mentioned before. And the cell bodies are located in an area called the geniculate ganglion. And this label in blue, it's the internal acoustic meatus. The third cranial nerve that I want to discuss is the glossopharyngeal nerve, and the functional component is going to be general visceral efferent, for example, for preganglionic parasympathetic fibers. It's also going to have special visceral efferent that innervate the skeletal muscle fibers. It's also going to be classified as general somatic afferent, general visceral afferent, and special visceral afferent. So specifically, the glossopharyngeal nerve, cranial nerve number 9, the function is going to be mixed. So there's going to be some sensory functions that are working for tongue pain, for example, or motor functions such as for swallowing. And then the origin of this nerve, it's the posterior 1/3 of the tongue, right? So I'm gonna label it here. It's the posterior 1/3 of the tongue, and the motor part is gonna be for the salivary glands. Also, the foramen, it's the jugular foramen, and I'm going to show it to you in another view, but the destination for the sensory fibers is the medulla oblongata, and for the visceral motor part, it's the parotid salivary glands, right? Parotids should be here on the face. I'm going to show that to you in another view. And then the somatic motor, it's going to be pharyngeal muscles for swallowing, right? And then lastly, the sensory neurons are in the superior and inferior ganglions. And this is the jugular foramen label in blue. And if you want to learn more about this information, you can click on the card on top of this video or wait at the end to find more suggestions, because I have a full playlist on the nervous system that you can continue watching and learning more. And that is it for this video. Don't forget to subscribe, like, and share. And if you have any comments, questions, or suggestions, you can always comment on the comment section below. Thank you for watching. I'll see you next time. Bye.